So currently I'm in Uganda. It's a bit midnight. I don't know if it's the same with you that side. So if the communication gets stuck a little bit, just know currently we are facing some connection issues. So I, Samantha, will be presenting systemic barriers faced by transgender community in East Africa in access to healthcare, mostly gender-affirming care, and employment opportunities. Here I will be drawing you a picture. How is it like to be a trans person in East Africa? East Africa mean Uganda, like. So I'll be, how is the lives of trans people within our context of Africa? How do we live, how we behave? So, but mostly it's going to be around healthcare, healthcare access, mostly under gender-affirming care and access to employment opportunities. So let me see if I can share my screen. Hopefully everyone can see my screen. Hi.
We can see it.
You can see it. Okay, briefly, I'm Samantha Jordans. I'm a transgender woman and human rights advocate who's right now in Uganda. I currently serve as Executive Director of Feminist Inclusion Leadership Center. Some people call it FEEL. And also I'm a board member to Black Trans Travel Fund. It's in US. I have 6 years of working experience. I was once a voluntary worker. I was once a peer educator. Right now I'm in a position of being a leader. So mostly my experience moves around access to sexual and reproductive health for key population and for the LGBTQ communities. I'm going to be sharing a little bit around our organization, FEEL, which right now I lead as a leader. Feminist Inclusion Leadership Center is a trans-led feminist organization based in Uganda, determined to promote employment for transgender, non-binary, and LGBTQ women, individuals. We were established in 2019 and we are officially registered in 2022. Our focus as the organization is to enhance the access to healthcare, education, and justice for marginalized communities, particularly my community, the transgender community. We focus on multiple strategies to address diverse issues comprehensively. We are collaborating with local, regional, and international networks. FEEL Center, our impact is to advocate for positive change and advance feminist cause across Uganda. Our vision as the organization with the team I'm working with right now, we have a vision to achieve a just and a peaceful world where marginalized community, mostly my community, human rights, including health, bodily autonomy, dignity, safety, and security are safeguarded. This means are protected, are respected within our context we are living in. Our mission as the organization is a commitment to intersectional grassroots activities. That means we mainly focus on what's on ground. We get deep in research what's on ground, and we want to tackle mostly things affecting individuals within our communities we are really based in. A little explanation around that. This is a tracking exposing narratives around gender identity, sexuality, expression rights by actively promoting feminist concept, gender transformative approaches. We foster a change for social mindset, attitude, and transformational on gender discrimination, especially sexual and equal rights for the transgender and gender diverse individuals, including the KPs across the diaspora of social, political, and economical life. So at times people ask me, where are you based at? Which region are you from? So if I talk around East Africa, is a community which is part of Africa. But we are East African, that means we're inside of the East. And if you're inside of the East, our countries, now there are 8, they came together to form a community. That means we are one country, like the way you see United States of America has other countries. And now the East African, right now it's making a united communities. And I'm based where you are seeing the red arrow, that's Uganda. It's in between Kenya, Tanzania, DRC, and Sudan. Uganda is a divided country into 160 districts. And I personally, I'm a Muganda, my tribe, and my country is divided in several kingdoms. At first, it was a kingdom before it was led by kingdoms. Before it became established as a country, it was led by kingdoms. And the clan I'm from is called the Baganda, one of the biggest traditional kingdom within our country. And our kingdom was abolished. The Baganda was abolished in 1967 and were restored in 1993. Since the restorement, because during the restorement, our current president wanted to rule again, wanted to become a leader, like a president. So this shows over the trust from the community, he wanted this kingdom to be in place. So since 1986, we have been led by a dictator, let me say like that, President Yoweri Kaguta Museveni, who is making him one of the African biggest serving leaders. So here's our cause. What have really brought us here? Let me not get off track, and let me thank the audience who are with me. So are we together? Can everybody hear me very well?
Oh, yes, we can all hear you.
Okay, thank you. So the main topic why we are here is to improve the access of gender-affirming care and employment opportunities for our trans community in East African communities. This is how my presentation is going to go, and let's go straight to the topic. One topic is for us to really understand. Many of you could be understanding and many could not, because learning never stops. And gender-affirming care is any kind of support that help us feel comfortable and accepted in our own identities, in our own gender. It could include using the right names, pronouns, wearing clothes that match how we feel, taking hormones, testosterone and estrogens, getting surgeries to change our body to our choices, talking to a supportive doctor or therapist. This could be easy to speak out for some people who currently have some little bit of democracy and favorable roles to our community. But I personally, living in Uganda, where currently we are being affected by a death penalty for the community and life imprisonment. And the bill right now it's an act. It was passed in 2023. Engaging all people who are under our community. And I personally, right now, to access such services, which right now are not available in place. And addition to that, getting them could be a little bit not available, and we are not recognized even that we exist within our country, because how will you come out loudly and be like, I'm this? So my own experience as a person to access gender-affirming care in Uganda, where I'm living right now, is a bit challenging, and it needs a lot of explanation, let me say like that. The only option is like, I do it self-medication. And if I get enough money, that's when I'll access a doctor. And so many people will be like, oh, which products are you using as a person? Currently, we use much more I use much more blockers, that's Pyracton, due to endosteroidone, it's estrogens. After blockers, you have to join other medication of, I've forgotten the name, of estrogens, which currently are unavailable on market, and pharmacies where we access them, they don't have such medication in place. So it's a bit challenging for me to access such healthcare within my country. And if we flash back to programs being funded by countries, by governments, by other ministries, under SHR, Sexual and Reproductive Health, mostly they highly consider HIV and other sorts of SHR, which some of them are also underrepresented. They are not seen on the chart of SHR, which is where gender-affirming care also falls in. We are seeing that most people don't really feel like they have to give outside support for the trans community, but we need it. So these are the statistics which I got from the report of Ethan. It's a regional organization. It did in 2020. And the data shows the number of trans individuals who are right now on hormone replacement therapy, and those who have no idea. This could be information how to start. This could be know the networks where to get such medication. This could be where to find a doctor. This could be a trans person need to find any laser operator. It shows around East Africa. The data was collected from local healthcare, trans advocacy organization, and regional studies. The numbers indicated here show how a bit challenging within our community that this large number and people, this was collected in 2020. That means it was in COVID. It was in COVID. Before we finish all that pandemic, it shows that the numbers are of people with no access to gender-affirming care services and knowledge. It's a bit high. And those, the 15 you are seeing isn't like they are getting the full access, the full gender-affirming care services. It's not, but they manage. They get primarily services like brokers, because those ones, they ship them in pharmaceuticals, and mostly that's mostly we get, and a little bit of healthcare, of which you find endocrinologist is a bit expensive within our country, and accessing him, it could be a little bit challenging. And some try to ship them like from South Africa and bring them. So you find even the 15, which they show they have access, is not stable at all due to my personal experience and the information I've got from the community. Here it's like challenges hindering us, individuals. Let me hope if, due to the, I would request use us. Is it okay? Can everyone understand? Hello?
Yes.
Is it fine? I use us.
Yes.
Okay, thank you. Out here is the challenges hindering us in East Africa from accessing affirming care services. So if we reflect on lack of finance and income opportunities, let me say, the most accessible way of income for trans women, it's sex worker, most of them, because that's one that doesn't need any qualifications, but I'm imagining on my reflection within my country, where they are facing criminalization, where we are facing criminalization. And similar laws are also being introduced with neighboring countries. We have seen we are in the middle, and all these circulating countries. Right now, DRC is in war. DRC right now, it's in war. We have seen Sudan right now, it's also in its own crisis. So for Kenya, it's also in its crisis. So for right now, they are closing asylum centers for our community. And if we move to Tanzania, they're also actually linking, as where I live right now, we are facing criminalization. So I'm showing like there is no way out. And due to the criminalization right now in place, sex working is no longer safe mostly for us. And we find some of our documentation can't allow us to get income opportunities. So you find that even though you have access, but you can't maintain like the supply to come to you. You can't because you are less financed. Let me say like that. You don't have any opportunity where, how will you sustain your affirming. And addition to that, other challenge could be public awareness and sensitization. So if we reflect to the public, mostly within where we're living right now, many public don't know who are we, because we are hindered with existing laws. So how will you be able to explain to the public to know that I am, and this is the kind of service I need in place? Like, we would love to make public awareness, but in which way? Well, when we're having right now a pushback as the community, you find that even doing public awareness to my needs, what I want, could be a little bit challenging for me. And lack of support networks. I personally coming out and be like, let me start such a network. It didn't just broke off the mind. I tried to get any accessible services for that particular healthcare, but I felt zero chance. The only thing I had to do to go online to teach myself, what's this? What do I need first take to achieve this? What's needed? So you find many KP organizations or DIC, they mostly care about HIV as the main priority. It's a life-saving healthcare, and we need it in place, but not like we don't need other life-saving health support. There are more we need as us, which we need the community, the public, to help us to get such information. Could be knowledge, could be what challenges will I face if I start this type of healthcare? Do I even have the supportive network which motivate me to proceed with my desires, with my feelings, because at times you feel like you don't have parents take care of you. Then you are the parent yourself. You find that these centers, they lack information to that type of healthcare. And this one, as it did, I may skip it, like, we lack family and parental support. We do, most of us within our community, mostly the transgender community. We fall apart and we have to drive our way out. This one, I say restrictive laws, legal system right now in place where there's death penalty, so you find that such laws, it pushes you back as a person to be like, how will I explain to such person that really I need such services? How will they really listen? Limited access to endocrinologists, limited availability of gender-affirming supplies, systemic stigma and discrimination, limited funding for mostly right now, our center, we are doing it voluntary. That means there are limited fundings for such programs, and harmful social stereotype, and lack of safe and inclusive spaces. Possible solution, these are into our programs as field center. We hope to establish, right now they are running, we have economic empowerment programs. These are through vocation trainings, financial literacy programs for our community, the transgender community. Let me see. Through the transgender community and connect online and community awareness campaign. Since we have restrictive laws, we thought as the center, everyone has a right to speak for their life. And as engaging with the conducting online awareness campaign can help us to challenge the narrative around our broader community and to bring out a bigger picture for my community. And we have seen it's a little bit challenging right now. This is shrinking support funds in place. We hope to develop peer support networks. And also, due to restrictive laws, we hope in future to engage with policy and to engage in policy and legal advocacy. This will work together with human rights organizations. We engage with policymakers in order to challenge the narrative to help the accessibility of some resources for our community and expand safe healthcare and expand safe spaces and healthcare access. Hopefully by 2026, if things go well, we may establish a DIC as a center to help us prolong the accessibility of this healthcare within Uganda, but hopefully for more funding to be available in place, we'll expand resources to reach other transgenders in East African continent. We hope to partner with medical experts, like we may partner with 5 or 2 for a start. These may sign confidentiality documents and will help fellow us, like me, to access this healthcare in a proper medication way. And we hope, due to we find that these pharmaceuticals have medication, which are blockers. Why can't they have other supplements after blockers for 3 months? What other medication could go? We hope to collaborate with pharmaceuticals to increase the availability of the medical supplies for our community. And we have seen many people within our community don't have enough knowledge. We hope to develop a tool, it's like a kit, to help them, guide them. This will be a PDF and a video online. And in video will be translated in a local language and international language, like English, where we are English colonized country, so we use mostly English. So for people to understand really what exactly thing are you heading yourself into, where you're going to face stigma, where you're going to face hate speeches, but you have to fight for your life and you know what you need. So this kit will help our fellow transgender to guide them before starting even the process of joining gender-affirming care process, because it's a process and you need to be careful in what you are going to, because a lot is coming with it and a lot we are facing it right now. Establish a complement merchandise. This could be, right now we have the accessibility of HIV, which right now is shrinking due to encroachment of Trump freezing the funds, the USAID funds. So the accessibility of HIV right now services are also shrinking. So though they are shrinking, some of my fellows are facing stigma. So this complement mechanism will help us to challenge the stigma within the institution which practice inclusivity and whatever. So it's like trying and heighten the accessibility. We use international platform to amplify local challenges, pressure the government for inclusion policies, develop community led fundraise strategy for the affirming care, and also to create testimonial short videos, me too, like people talking how gender affirming care right now, how they access, it's like, it's strengthening, it's pushing other people to know what they are doing is really helping many individuals to access such services with the help of field center in place. Other topic, due to the time, I will be a little bit summarized. Other topic was about employment. This is the huge problem affecting our community. It's like 90% within our community right now, they're not working, and they are youth. They are not working. So employment is being more than just having a job, but it's about being able to earn a living, support yourself, other beneficiaries. Some of us, we still have a little connection with our young brothers and sisters. So you find them, they need your support, but you can't stand there as a person to show them, right now I'm old, I can really help uplift you, because we don't have any employment to do right now. This provides a sense of purpose, sustainability, personal growth, and shaping someone's identity and social communication. You know, when you're empowered, you have a job, you can sustain yourself for a meal, it's a little bit, it's a win for some of us to be like seeing many fellow trans persons are employed. It's like we're achieving. Now, if we're seeing every day, people are struggling with stigma, but they are still in bed every day. They are doing sex working where they are being beaten, where they are being undressed, where they are being imprisoned. So we are doing a work we love, but also we face shame from it. Humiliation comes with it because of the existing laws which don't protect us. We don't have labor laws which protect everyone. So you find that you're in a country where Ubuntu isn't practiced and humiliation is much uplifted with injustices for our community. So this is also statistics I got from Ethan, and highlighting the economic initiative financing literacy skills. And as I told you, 90% in 2020 were unemployed. That's during the days of COVID. So what is it like right now? That 90 could have been right now, I think it's 100. Most of them youth aren't employed at all. So it'd be like, oh, the trans are no longer. It's also reflect to these are also statistics I got from a journalist made investigation around the youth at age of 12 to 13. And the report shows that 70% of the East African community youth are unemployed. And the rate of 30 are employed. These were statistics I got was for 2014, but there's more other statistics which were produced in 2023, though they needed some payment. So I managed to use this. So you can do a deeper research around it, but mostly that's I managed to get. Many big challenges we are facing to secure better employment opportunities. Workspaces and hiring, we are facing discrimination. This comes from the bit you enter the office request for a job or any establishment. They first ask for academic documentation. You present them, let me say, the names and the current names I'm using are a bit different. Even though I'm employed in that institute, there will be discrimination within the fellow organization who consider to be allies to us. you be like, here my safe space, but always you feel insecure and you feel like this is not a perfect job for me. And we are facing inequalities and limited education access. As I've told you, percentage of the trans youth within the East African communities, most of them who have managed, let me say, to try education, they're like on 100 to on 1 to 100, they're like 80 who have not accessed tertiary education, who have not accessed secondary, who have not gone to any institute. So you find that, and also inequality comes to poverty within our families, and also other bullying in schools. We face stigma. Some of these challenges hinder us to access better education, and if we reach in employment market, it can be a little bit challenging. Unfavorable laws, as I said, are difficult in changing legal documents. So if there's no laws which are protecting me, so changing legal document can't be easy at all. Low self-esteem we are holding as with a person, limited funding for enterprise, socially caused stereotype, and limited access to development skills. We lack it within our communities. So these solutions, we sat down, either the solution right now we are working with to see, with which I work with my team at Field Center, to see how can we increase the employment opportunity for our community. How is it like we can better the employment sector for the community? It's like we need to engage more with policymakers and institutions for inclusive policies on hiring and to challenge workplace discrimination. We hope, as a center with the team, to advocate for inclusive education policies, because the policy in place show that every child can access education. What of a child who is being disowned by a parent at the age of 12 or 14 because of their gender identity and sexuality? Why is this child not protected? Is still a child who is going on street to fetch into the life she didn't hope to. She needs a second chance to strive their life for a better future of them, to access better education, to access better skills, but they are left with no protection to secure that a child is still a child who needs a protection of a parent and the government intervening for his or her protection. We hope as a center to establish a scholarship token. This will be mainly offered to university students who are transgender and non-binary individuals. As a center, we hope to advocate for reform of labor laws and existing laws, because all of these, if the laws aren't available, many would have changed. If labor laws are really favorable and non-discriminatory, many individuals would have achieved more. And we hope to collaborate, and we have already partners we are collaborating with who are legal and into human rights institutions. And we hope to enlarge our society with them. We open our door to them because we can't work around challenging legal laws and labor laws without a lawyer intervening in to show the narratives around their laws in place and how it's affecting the youth from accessing employment opportunities.
Samantha, I'll just have to ask you just to conclude quickly, just because we are a little bit over time.
And we hope to offer mental health support and confidence building. This will be counseling, mentorship, and employment opportunity. Mobilizing resources for enterprise, establishing microfinance, and use online campaign from our short video, which will collect interviews, documentaries to challenge the stereotype and empower individual with vocational skills, which right now we are aiming to as our main agenda to establish a center by April. We are starting our fundraising to establish a center which will help individual to get skills. And as I said, documenting individual and their parents' lived realities. This will help us challenge the narrative around us. These are our current programs as the center. Comfort for All program, East African education support, and leadership and capacity building for our community leaders and organization we work with, health and gender-affirming care support. Right now, these are the programs we hope to run for the next 5 years to come. So this is the conclusion, I think. As an audience, as listeners right now who have given me their time, what role can you play in helping the center right now I lead as executive director to improve the accessibility of employment opportunity and affirming care services for our community in East Africa? It's like donating and fundraising for our current program, volunteering your time and sharing your expertise. You know, we are living different dynamics, different power contests within our country. So we need to know, how did you manage to achieve? We need such expertise to be put under our programming to achieve best of us, and sharing our messages and following our social media, our media handles, subscribing to our newsletter and becoming a monthly donor. Thank you. Nice giving me your time. And I remain as Samantha Jordan from Uganda, and a powerful, brave person for my community.
So yeah, now for a proper start. Hello everyone, my name is Patrycja Andrychowicz, and I'm a young researcher and an activist from Poland, and I have been engaged in different forms of queer activism for the last more or less 6 years. And although I've worked in many different things, from like pride organizing to some direct aid, to helping specifically queer kids, something that I've been specifically interested in quite recently is mainly queer-specific healthcare and healthcare issues, which also includes trans healthcare. And so today I wanted to speak with you about one research project I've done, which was specifically on one portion of gender-affirming care in Poland. Basically, this was a research project that I've conducted, which was more of an ethnographic qualitative study, where I combined both looking through just, resources created by the Polish trans community, and also compared it with the official standards or like documents issued by institutions, with also 14 individual in-depth interviews, so like qualitative interviews with different Polish trans individuals who have underwent sexological diagnosis, which is necessary in Poland if you want to continue with medical and legal transitioning. I will elaborate on it a bit later. And at the time of the study, the functioning diagnostic standards in Poland were the ICD-10. So also I've done it in accordance with that. And yeah, just for this methodological clearness, the people I've interviewed were both binary trans people and non-binary people who seeked gender-affirming care. And also for a little bit of a theoretical background, although I will not include quite a lot of it, a perspective that I've had very much on those forms of resistance or like response to the barriers of trans people were ones where I followed this theoretical concepts of navigation and weak resistance, which basically are described as different forms of everyday action or action in a situation of an even hierarchy, which are not this like grand revolutionary type of resistance, but rather smaller acts that aim at bettering your situation, the situation of your group, that doesn't necessarily aim at changing the system, but it is a way of bettering your means, your living situation, which in this case I believe is crucial. But yeah, before I talk about the results of this issue, of this research, and I also map out some, in my opinion, key forms of the systemic oppression and accessing gender-affirming care, as well as the responses of the trans community in Poland, I wanted to talk with you a little bit about how the gender-affirming care in Poland works like. So as I mentioned before, in order to be able to access hormone replacement therapies or any other forms of gender-affirming care, as well as any legal procedures connected with changing your legal gender or your document name, it is first necessary, of course, if you want to do those things within the system, it is first necessary for you to receive a sexological diagnosis. And this is where the steps happen, because I think Poland is a very interesting case in how the law is completely not suited to the needs of trans people. It basically doesn't really acknowledge them in a way, because there aren't any actual procedures in place or actual rules on how the diagnosis or receiving any form of gender-affirming care should actually look like. So in practice, there are some recommendations made by some like associations of doctors or something, but they are not like legally binding documents and they're not actual standards. It's more so just recommendations. So in practice, it means that basically your first step of receiving this diagnosis, it fully depends on whoever diagnoses you. And there isn't any clear data that would maybe map out or actually bring attention to what is the most common experience. However, some information that we have out there is that, for example, the process of getting this first sexological diagnosis, so simply being, I don't know, quote unquote diagnosed, can be done by several different specialists, but also can be done by just one. And how many specialists you're expected to have, it can often just simply depend on who you go to. So you might go to one sexologist and they can tell you that, oh, I also have those different specialties, like a psychiatrist also, so I can give you all the necessary medical documentation, whereas some people have to visit a plethora of different specialists. Also, the time the diagnosis takes place, it can vary a lot. For some people, it can be just a month. For some, it spans over several years. And also when it comes to what elements the diagnosis have. So for some people, it might just be like a medical interview, whereas there are people who have to either go through more like psychiatry's means of testing, such as different diagnostic tests they have to fill out by hand, or handing in their like written life story, or going through the real life test. So basically they're expected by the doctor to live on a day-to-day basis, like fully embracing their gender identity, which is not necessarily very safe or comfortable for a lot of people, but it is expected. And also the psychiatrist or sexologist, they might expect you to go through different medical tests just to receive this diagnosis, such as a brain MRI scan or blood test to, I mean, there are still just different stereotypes about how different health issues might cause a person to think they are trans. So the doctors want to just cross it out. So yeah, basically, this is a necessary diagnosis for a lot of people if they want to get access to gender-affirming care within the healthcare system in Poland, not in a DIY way, and if they want to go through the legal transitioning, but still the process is very chaotic, very weird, and therefore I think it's an interesting case to study and talk about. And also one remark I wanted to do is that for a lot of people, the only way of receiving this care, this diagnosis specifically, but also other steps of care, is only through the private healthcare sector, which is highly expensive, but it's because there just are very little specialists that will provide you the care in the public sector. And a lot of them are also, like, even if they can in theory provide it, they're often known in the community as people who provide very bad services. They are just guided by a lot of harmful stereotypes. The diagnostic process takes a very long time, so it's not advised to go to them. But yeah, so yeah, let's talk about some key things. And throughout the presentation, when talking about different barriers or characteristics of the process, I will just include quotes from some of the respondents that took part in my study. I will not read them out, but you can read them for yourself. And so yeah, first I wanted to start with this quote from one respondent, which I think very nicely summarizes how the situation looks like. So on the one hand, there is very little systemic rules that just map out how the process should look like, which can be a good thing, but also can be a bad thing. And it can be a good thing because, as you also see later discussed, a lot of people can really kind of maneuver through this system. So for them, the process of receiving a diagnosis is a rather short one and a rather pleasant one. However, for other people, the lack of clear guidance and instruction can at the same time be quite harmful and can cause quite a lot of struggle. But yeah, so let's go to exactly that. So limited resources and lack of instructions as one big barrier. And basically, to kind of summarize this point, because also I feel like I brought quite a lot of those notions before when I was speaking. But yeah, for a lot of people, a big barrier, especially if they are still not very strongly embedded in the community, is just because there are no clear instructions on how the process is going to look like, or like no clear government provided or medical professionals provided guidance. It can be really hard to actually understand this process, know where to go to, know who to go to, and like a form of resistance very strongly presented here is also one that I think is also the most present one globally, which is simply using and recreating and reproducing grassroots resources for the community. So it will include both information on who to go to, so which specialists are worth going to, but also information on how the process might look like and how different it can be, and providing each other with instructions on how to best work through those different steps so you can ensure that you'll receive this diagnosis and not be rejected. Wait, nice. And another very big issue, which is connected to, as I mentioned before, the transitioning being mainly available through the diagnosis being mainly available through the private sector, is that it's very expensive and very spatially inaccessible. So especially for people in more rural areas, it can be that there are no specialists in their closest area which they can go to. And in a way, this lack of accessibility and in many different ways is something that, I mean, limits people mainly on a class basis, but also it simply becomes a very complex, I don't know, like in order to get your diagnosis, it becomes a very complex process where a lot of my respondents, for example, they said that like they received one, I don't know, like one diagnosis, like one recommendation from one doctor in one city, then they went to a different doctor online, then in order to get like an MRI brain scan, they went to a completely different city. So it becomes an extra complex process on top of that, because of all of those organizing issues. And I mean, especially since most people really would like to receive the diagnosis as soon as possible, additional costs and additional steps are increased. And of course, a way of dealing with it on like individual level is mostly just a lot of individual planning out and really trying to maneuver around those barriers for maybe finding specialists which are available online, and also different ways of fundraising, which are also a very common community practice in trans communities all over the world. And another really big issue in accessing this diagnosis is that most specialists which provide those diagnoses, so all the sexologists and psychiatrists and psychologists, are often very strongly embedded in a very stereotypical view on gender, which includes very binary view of gender and very strong gender norms. And a lot of people in the process of receiving their diagnosis are expected to fit and to match those categories. And if you don't, it's very likely that you're not going to receive it, or that it's just not going to look well enough, and your process might be extended. So what a lot of my respondents did is, for example, they hid their non-binary identity and rather presented themselves as trans-binary person in order to just be able to have a higher chance of receiving the diagnosis. Similarly, a lot of them hid or lied about their sexual identity, because also with a stereotypical view on gender, you have a stereotypical view on sexuality. A lot of them also, when going to the specialists, made sure to look in a very stereotypical binary gender way in terms of their makeup, their haircut, their clothing, even if it's not something they exhibited. And a lot of them just pretty much lied throughout the process about their experiences as a child, about their preferences, their hobbies, because this was also something that they've been asked about. And here there's this big quote of one respondent who described her experience filling out one test, which also other respondents mentioned filling out, which was supposed to check your true gender through asking you whether you like flowers or whether you like to fix cars. And so of course, in situations like that, you're going to lie. And I think this very nicely also contrasts how, on the one hand, there's this specialized medical knowledge, which is not really aware of how actually gender works, and the trans community that is very much aware of those stereotypes and just kind of abuses them or lies in order to get what they want. And with this, it's also connected this trope or figure of a trans trickster, which has many definitions, but I wanted to bring up one which is mainly used by a theoretician, Stephen Schuster, which is mainly used in the context of trans medicine. And Schuster describes it as just this belief by medical professionals that a lot of people want to receive trans-specific gender-affirming care, not because of their own need of wanting to receive it, but because they have some form of an ulterior motive, or they are just in some way psychologically unwell, or they just have some, I don't know, just ulterior motives. And this is definitely something that was a lot of the time also exhibited by professionals who were diagnosing my respondents, where a lot of the respondents expressed that if they were not presenting themselves as very confident in gender, or, for example, if they are also mentioning that they have some psychological issues, their chances of receiving the diagnosis were much lower, or maybe they were even rejected from the process. So they decided to hide some elements of them and also come very prepared in order to avoid this repercussion. And as last part, something that I wanted to bring out is something that I think is just present throughout the entire process, as with all medical topics, and this is simply the very strong hierarchy and power relations which are present within the entire diagnostic process. And here I wanted to just maybe mention some stories of my respondents, and maybe a little bit of a trigger warning, because some of them are rather traumatic, I would say. But a lot of my respondents were just simply abused by their doctors. One of the scariest stories is one of a doctor, which is actually quite well known in the community, especially since I don't know, a few years ago, where the trans-specific care was not so available, it was one of the few doctors who was actually providing people with diagnosis and also immediately prescribed you hormones, which is very rare. And it was also done very quickly. However, it was done at a cost of this doctor taking pictures of you for his research, and those pictures were naked pictures. So there were respondents which were basically forced by a doctor to just stripped and get some pictures of them done in order to receive the care. Another story one respondent shared is one where the doctor kind of did not specify, kind of tricked them to go and visit them in a different city in order to receive their diagnosis. But before they got the diagnosis, they were asked to just be a part of a class of like medical students and answer very personal questions, where they were put in a situation where they couldn't really say no because they were afraid that if they reject the proposition of the doctor, they're just not going to receive their diagnosis. And there were many other similar forms of just abuse of hierarchy by the doctors and just rejecting people also based on like fat phobia or other prejudice. And yeah, that's definitely a very big barrier faced by the respondents and in general still the trans community in Poland. And it's also one where there isn't really a form of resistance against that. It's just the only form of resistance, simply awareness of those things, but you can still fall victim to it, even with the best specialist. And I guess this is like a kind of a counter argument to the broader point of the lack of regulation and a big freedom being a good thing. Well, in this case, being able to report it and having a more standardized process where things like that are not possible would definitely protect a lot of trans people. And yeah, this is basically where I'll end it. Quite frankly, I was not looking at the time, so I don't know how long I've been speaking. I hope it's not very over time, but yeah, this is more or less a quick summary of the research project. And yeah, I would also say on like a last note that if any of you are interested actually right now, Poland is in a very interesting place in terms of the regulation on legal gender recognition, because yeah, the situation is rapidly changing and the law is probably about to drastically shift soon in a very good direction. But regarding the medical care, there's not really much projects going on right now, so let's just hope it will shift. Yeah, thank you.
Hi, everyone. Before I start, I just want to say how honored I am to be here with so many trans siblings. This is such an incredible space, and it's really a privilege, and it's a privilege to hear everyone else's stories. So this is going to be a bit of a wild card. You've heard a lot of academic presenters this weekend, and you're going to see by my slides that I'm the only fashion designer here. So I hope you enjoy. This is actually a presentation that was developed mostly as a guide for allies in how to support trans and gender diverse folks. I didn't know so many of you were going to be trans, so it's really exciting. But I hope that it's going to serve more as a resource that we can share within our communities and that you can take back to businesses and organizations that you all work with. I do really hope that it's something that can get shared widely because it is more of a guide than a study. I don't think that people should have to reinvent the wheel every time we go into new spaces, especially workplaces. So this is something that's going to help us advocate for ourselves and for others. So I'm Ray. I use they, them pronouns. And got it. I am the founder and owner of Canada's largest gender-affirming clothing brand. It's called Origami Customs. And it's amazing to be back in Victoria. I'm from here. Thank you so much for having me on Lekwungen territory. I'm joining from Montreal, Jojage Munyang. There is going to be a lot of information in the presentation, so don't worry, there's a QR code at the very end. You can download it all. So it's a bit about me. What is my vision for trans futures? I was debating this as I was writing this, and I think it can be summarized in terms of specific relevant frameworks for businesses, academia, and organizations to support the realities of gender diverse people. When I set out to create a custom-made lingerie and swimwear brand, I couldn't have pictured having employees, let alone trans employees. I was just one trans person with a dream. living on a very small island. And now 15 years later, I've worked in and for the gender diverse community as one of the front-running gender affirmation brands worldwide. The brand focuses on pieces that are for trans people and not as an afterthought. Each piece is custom fit to each person's unique body. I also created a community program that uses the business's income to provide gender-affirming gear to folks who lack access. So the program provides gender-affirming transition supports to people who face those limited accesses through a global network of over 100 NGOs and businesses. From the beginning, I knew that I would not just be creating garments overseas in factories that relied on mostly the labor of women of color. So I hired people from my community because, of course, gender diverse people should be the ones making products that are for gender affirmation. That just made sense. What I didn't know when I hired and trained my staff members is that creating not just a safe space for gender diverse people, but one that responds to their specific needs is a totally different HR challenge. And normative frameworks used in schools, universities, and organizations and collectives don't consider the often delicate and shifting needs of gender diverse folks. So transitions are not from point A to point B. We all hold flexible, expanding identities, which evolve over time, and breaking out of that rigid mold of what a transition or a transitioning person looks like is that first step towards seeing trans and gender diverse team members as complex, shifting humans with valuable spaces within our organizations. So what do I mean when I'm talking about trans integral versus like safe for trans people? For me, this means it's generated through feedback at all levels. It's holistic, it's flexible, it's built in and not an afterthought, and it's both intentional and practical. So how can we advocate for policy change that supports the well-being of all of our expansive gendered experience? Well, first we can do this by identifying our own unconscious biases. Second, it's really important that we provide ongoing training from qualified, diverse consultants. Safety shouldn't be based on passing, especially in professional environments. So how can we allow for authentic expression without judgment? Trans people don't owe you passing, especially in professional environments. We can question our hierarchies. The most valuable insights can come from the people in positions of less power. And we can get feedback and listen and allow for people to self-determine. People often just know what they need. It's an issue. A 2020 Stats Canada survey indicated that 47% of trans and gender diverse workers were targeted for sexualized and discriminatory behaviors at work. So what can we do about this? First, we can create a policy ahead of time so that you're not scrambling if someone asks you for support. This can be created with the help of anonymized feedback forms to further accessibility in giving suggestions. We can allow for creative and flexible solutions. We can come up with sexual harassment policies that go further than just the standard one. For instance, we can recognize microaggressions, talking about intersections between different identities and how sexual harassment is reported. Basically, we're talking about trans people in bathrooms here. We can consider creating specific guidelines for how staff are visually and textually represented, letting your staff self-determine how they're talked about and how those photographs are going to be used. So at our studio, we created a media plan from a trans lens that encompasses how the models would like to be presented and how they want to have those photos used. For example, it includes what part of their body they prefer to have emphasized or de-emphasized, how they want to feel when they're on a photo set, and what poses they were going to feel best in. So being a highly visible trans person is really worrisome, especially right now for some people. So we talk about what platforms offer the most and least amount of safety and keep an updated record of where each model wants those images to be shared. So we did struggle with shifting consent due to transition, dysmorphia, dysphoria, all of that stuff, and how our standard policies are not made to be nuanced. We tried to come up with something that was better, but it's been really tough to come up with a media plan that doesn't just create and recreate power dynamics that make it impossible to withdraw consent. You'll notice that in my presentation, I use a mixture of licensed stock imagery of trans people and images of our models in the studio, like this one, because our staff didn't consent to have their images being used in this context. So I want to talk a little bit about identity data and forms. To the greatest extent possible, we want to allow people to self-identify in their sex or gender identity. The options of a blank box, for example, is often the most inclusive. Consider whether there's even a legitimate need to ask for and collect this information, and if there is, providing options beyond the binary of male and female or man and woman. Pretty basic. You want to check in with all your new folks about their pronouns, regardless of whether you think that they may be gender diverse or cisgender, and build in pronoun usage across forms, email signatures. That's the bare minimum these days. We also want to allow for neutral honorifics, like mix or none at all. We can maintain a straightforward process for people to update their names and pronouns as they need to, undertake system reviews to identify how electronic databases, IT systems, and other relevant information processes can be modified to recognize a person's chosen name and gender when it doesn't match their legal documents. We can protect all of this information indicating their status as a transgender person or a gender diverse person as confidential. One local hotel recently told me, this is where this visual comes from, that they custom built their booking platform to add a box for the name if it differed from that on their credit card or ID, since those are required to make a booking, but it can be often outdated. Other policy inclusions have to do with having clear procedures for reporting harassment or discrimination, added confidentiality for people who are reporting issues, making sure to write with gender-neutral language in job descriptions, a clear policy stating zero tolerance for discrimination or harassment based on gender identity or expression, and making sure that we know what we're talking about when we use those terms, and eliminating gendered dress codes. So how do we create a guide? This is going to be an awesome tool to have regardless of where you're working or gathering. A comprehensive transition guide could cover the following: a lead contact person to assist with the transitioning person, clarity about what to expect from your managers and HR, as well as what's being expected of the individual. The general procedure for implementing transition-related workplace changes, such as adjusting personnel and administrative records, and communicating this plan to any person that they're working with, coworkers and clients. One of the most crucial ways you can support a gender diverse person is advocating for them with obviously their authorization. It can be useful to discuss the timelines and dates when the transitioning person would like to be addressed by their new name and pronoun, begin expressing their gender identity through clothing in keeping with their dress code, using the washrooms that they want to, and potentially taking time off work related to their transition. It can also address, when and how their employment records are updated, if, when, and how the other employees and clients will be informed of their transition, and when and how training will be provided for the other employees. Now I want to talk a little bit about washrooms. The absolute best thing you can do is to advocate for universal and inclusive washrooms. However, if a remodel is not going to be possible, here are some alternatives. Recognizing the right of trans people to access facilities based on their lived gender identity, communicating that the trans person will not be required to use a separate facility because of the preferences or negative attitudes of others, making clear that the accommodation options will be provided on an individualized basis, and providing adequate information and signage where people can find the right bathrooms. Rigid binary categories are built into nearly every institution in both overt and subtle ways. So how can we break down what a gendered category means? For example, in the case of washrooms, do we mean toilets and urinals instead of men's and women's? What gendered categories can we merge, eliminate, or find new language for? For example, in my underwear line, most companies divide clothing and especially underwear into men's and women's to match not only the style, but the perceived binary of the genitalia. So we completely eliminated those binary categories by making every style available for every body. We allow customers to select their gusset width, that's the little triangle that goes between your legs, allowing for modifications to fit any shape of body. So I'm going to talk briefly about healthcare a little bit, because as we know, all of us face unique needs and challenges in accessing healthcare. Here are some policy changes that can help your staff feel supported. An example of an existing barrier is that some insurance providers require a diagnosis of gender dysphoria to access gender-affirming benefits. However, this diagnosis entails a lengthy and costly effort that some people do not have access to. Employees should either advocate with the current insurance providers to remove those requirements or advocate for another insurer that will. Extended healthcare benefits should include coverage for mental health services as well. We all know trans people need this more than anyone, including therapy, counseling, and support groups. A little bit more about extended benefits. As we know, some gender-affirming procedures are covered by provincial healthcare and some aren't. Typically, provinces will cover the cost of major surgeries. However, not all provinces have specialists who can undertake every surgery. So we all know a lot of people come to BC or they come out to Quebec to get the care that they need, and they usually pay out of pocket, and it poses a significant barrier to necessary care. So what we can do is advocate to make sure that we're covering those gaps and making sure that we're covering non-major healthcare, such as hormone replacement therapy, laser hair removal, facial feminization, tracheal shaves, hairline reconstruction, counseling, post-op care, all that kind of stuff. These are often considered more affirming than the essential major ones. So most of you are probably not in HR and policymaking roles. So how do we convince people in positions of power that this matters? You can provide examples. I've got some great ones after here, but you can find other organizations offering free resources. You can hire consultants that have the lived experience. You can ask your HR to keep up with ongoing trainings, not just for trans and gender diverse inclusions, but disability access, racial biases, and others, as it often reflects and supports the intersection identities of trans and gender diverse people. You can work together to form a coalition to advocate for policy changes that support trans and gender diverse folks, even if there's none currently working with you. But that's probably not the case here. You can talk with your team members about how to set aside room in your budget for this. So these policies support not only the people in your businesses and organizations, but also those with gender diverse family members, the people in your professional sphere, clientele, and other people that you come into contact with. You are setting an example for everyone that sees you doing this work. Becoming trans integral space, it's not going to be free and it's not going to be simple. You will keep committing to these practices that may only affect a small number of people on your team, but knowing that the benefits are worthwhile and align with your vision. The policies aim to create a vision for common values like empathy, authenticity, and dignity. We also want to ensure that the values are not just embedded in the framework, but exemplified in the day-to-day culture and communication. By shifting the onus from the individual to the collective, we're able to acknowledge the role of care work in developing interdependence within the world of trans and gender diverse healthcare. Whether you work with grassroots NGOs, a small business, a large corporation, you can use these frameworks to advocate not just for a trans inclusive space, but a trans integral one that celebrates the unique diversity of trans and gender diverse folks. Thank you so much.